So I wanted to create a demonstration video for providers slash physicians on how to admit a patient. This will also apply to transferring patients from one unit to another as well, to a certain degree. And not everyone works in Emerge, so you may not be familiar with this routine. So I'm going to have Corey share it with all you guys so that you can sort of have this as a reference. It's also available on the intranet when I've completed it. So the first thing you want to do, so you want to be on the right tracker. So you're probably going to want to be on the physician ED tracker here if you're admitting from the ED department, which is the most likely thing. If not, you can also work from your acute trackers if you're just transferring the patient to a unit. So I'm going to go ahead and highlight the patient. So I'm going to select this Mr. Car Crash guy. And then I'm going to go ahead and click on my orders. So before we start the admission process, the one thing that you want to make sure that you've done is you want to make sure that you've asked the nurses to do a BPMH, best practice medication history, or best possible medication history on the patient. So you do want to put forward this order as soon as you know that you want to admit this patient. You should put this forward, and I recommend putting a star on these orders as well, as you'll probably want them to be part of your favorites because it should be part of your every admission routine, and then it'll be readily available for you. So now that we've done that and the nurses have reconciled the meds and they're like, yeah, okay, go ahead and admit your patient, doc, the meds are reconciled. You do want to wait for them to do that before you go to this transfer admit because you're going to reconcile whatever's there. So resist the urge to go directly into enter orders and putting into admission order. What you want to do first is you want to reconcile whatever's existing on the patient as is in the department that they're in. You want to reconcile those orders first. So that's where we're going to go to this transfer admit button. And we're going to press on that. So first piece of that is you want to select a location for the patient. So we're going to send the patient to med-surg in this case, but you may be transferring to ICU, whatever it might be. It'll all look exactly the same way as it does here. So when the patient has existing orders in play, you do want to reconcile whether or not you want to continue these orders. 90% of the time, you're probably just going to want to continue them all and go ahead and click those. But you can also select a stop if you wanted those orders to stop instead of continue. So go ahead and go through those and decide which ones you want. For this BPMH one, because I want it to start immediately, I want them to do that right away, I'm going to go ahead and select this now box, and that's going to trigger that order to occur also in the emergency department or whatever department I'm in, as well as the department that the patient's going to be moving to. So once I've reconciled all those pieces, so because we've asked the nurses to reconcile the meds, you'll notice there's no red question marks in front of these medications. If you see red question marks, that's because the nurses have not yet reconciled these medications. So these have been reconciled by the nurses, and we're just going to go ahead and individually select the medications that we want to continue. So you're going to notice when you click on the continue button, the medication automatically transfers to the next column over. If it's a PRN medication, it will require you to click on the drop down. You'll have a red button on a drop down menu, and you'll have to indicate what the reason for the PRN medication is. So when we're continuing a medication that we want to change the dose, for example, this patient's on 25 metoprolol and we want to increase that dose, go ahead and hit the continue button. And then on the opposite column, what you're going to do is you're going to select the dose, and you're going to put in the dose amount that you want that patient to be changed to. You can do the same thing with the frequency as well. You can go ahead and change the frequencies as you wish. You can make that happen now, or you can wait until the patient goes to the unit that they're going to. So that's what this box is going to allow you to do. So I'm going to wait until the patient goes to the unit. For now, we're just going to leave it as is. So that's how you're going to go ahead and reconcile the meds. And you can also hold a medication. All of these holds and continues and changes when you discharge the patient will be reflected in your med reconciliation, and you'll have options to either resume or continue with whatever you've chosen here today. So now that we've got all these medications and all these orders reconciled and ready to go, we're going to click our submit button up here. It will ask you if we have not yet administered these medications or the patient may not have taken them. You may want them to be given now, or you may want to just have them start tomorrow. If you do select now, it will then subsequently ask you to select when the next dose is going to be. So you can go ahead and resolve that particular request. You may also get conflicts with regards to other medications the patient's on that conflict with what you have, or allergies, and you'll resolve those either by overriding or by discontinuing or stopping that particular order. So now that we've put forward those orders, we're going to go ahead and save, and we're going to let that go through. So you're now going to have a yellow flag. And for the nurses now, this is going to be basically the equivalent of having a pink sheet for admissions with a flag on them that is going to be processed once the patient arrives on the new unit. So that deals with the reconciliation of the medications and orders that you already had on the patient in the department that you had. However, now we may want to add orders. For example, we want to do an admission order. Sorry. So you want to make sure that you stay in this transfer admit button. Don't resist the urge to go to this enter button as I just did. You want to stay on your transfer admit, and you want to go to add new. Okay. You can go ahead and click on add new, and then you can put in the word admit. I recommend putting the word admit for all admissions, as it will automatically give you a list of order sets based on diagnosis. So you can go ahead and scroll through these and select which one you want, or you can put admit and then a diagnosis, and you may narrow down the search as well. Avoid using the generic admit med-surg and admit critical care, as it's recommended by the one program to use the order sets that are built there for you. But those are there for you if it just doesn't fit quite the way that you want. So when you do go ahead and select a admission diagnosis, what's going to happen is, so you're automatically going to have a few mandatory options come out of here. And ahead and put my admission diagnosis. This may carry forward from the complaint that was put in. However, you may change this as well at this point. For isolation, it's recommended to leave that part for infection control and nursing. However, you do have the option here to select those if you want to control that piece of things. There's nothing wrong with that at all. So the other thing, so the MRSA screens are mandatory, as well as VREs for any admissions coming into the hospital, as well as COVID swabs. In current state, these order sets don't have VRE or COVID swabs added to them. So if you are thinking of that right now, if you can go ahead and add those orders as well once you've completed this routine, please do so. If not, then just maybe remind the nurses that they're not in there, and then they can manage that piece to make sure that the admission is complete. So the physician handover. So if you are planning on passing this patient to another physician, when you select that piece, you're going to be able to either hand over to the MRP that you've selected, or you're going to be able to hand over to the consulting physician. So in this case, we'll put MRP, and you do want to put in the name of the physician that you are handing over to. You do have the ability to select a date here and a time as to which that transfer occurs. The default is the next day at 7 o'clock. But that is adjustable based on your conversation with that physician. The other thing here, resuscitation. So resuscitation status is an order in this system. So you do want to address this if you have it, if you have the information on hand. So we can go ahead and select full resuscitation or resuscitation. We do have the option to do a limited resuscitation as well. And in that limited resuscitation, you can select which interventions apply. So the patient may have agreed to defibrillation and chest compressions, but doesn't want any other interventions aside from that. So you can narrow down your advanced directives this way. And then you need, it's required to where the source of this information. As a physician, you can go ahead and select physician, or if you've had the conversation with a patient themselves or family member, you can select those as well. And then you're going to go through your diets, and then your regular orders. So you do have activity restrictions here as an option as well. So if you want your patient on bed rest or limited activity, that's an option there. And there's a couple of things. So you can have a confusion assessment if you're worried about a delirium with your patient. Oxygen can be an optional piece if you feel that you want to order that. You can go ahead and do that. And this is pretty much on every order set out there. You do have your IV maintenance and boluses that you can also order. And when you order into those, you can go ahead and select the amount, and then you can actually adjust the rates at which stuff is infusing. Maybe you find that your $9.99 is too fast for your bolus, and then you maybe want to follow up with a subsequent IV. Again, you only have one option here. However, you can go ahead and select that dose and change that dose on that particular IV. You can also, if you want this IV to be something that you're going to continue as a regular scheduled IV, you can go ahead and click on this bag, and you can actually put in the amount that you want. So maybe I only want this patient to get 3 liters, and then I'm going to discontinue, I'm going to limit that to 3 liters. You can actually limit that by selecting on this little icon and putting out in the exact amount that you want to give to the patient. So that way there will no longer be IV required at the nursing end after 3 liters. So that's a good little tip for you. And then you've got a couple things that relate to the order set specifically. So those are the next pieces are going to be relating to your order set specifically and medications that are recommended. So this VTE prophylaxis is going to be on pretty much every order set as well. If you're choosing not to go to Lovenox, you do want to make sure that you select this. Otherwise, if you want anti-embolic stockings or your enoxaparin compression, pneumatic compression devices is something we may look at in the future. So you can go ahead and select your Lovenox or your none required, probably because the patient's already on a blood thinner. So you can select those, and then you've got an option for labs as well. So you can queue up your labs for the next morning, or you can make them stat if you wanted them to be stat as well. So when you order medications as an AM draw, you do have the ability to put them in a series for several days. You can also change the time, the date at which that series starts. The other thing here, so send someone from the department is automatically selected for you, which is what you probably want 90% of the time. However, keeping in mind, if your patient is a critical care patient and has an ART line, you may want to change this to a pre-collection label. That will trigger the ability for the nurses to trigger their labels on the unit when the patient, when the blood work has already actually been drawn. So just to keep in mind, you may want to select that if you've got a patient with an ART line or a central line or a PICC line that we're drawing from on the nursing end. Otherwise, this will go to the lab, and the lab will be the only department that has that instruction. And then you go ahead and select whatever you want out of there. You do have x-rays for this particular order set, as well as ECG, your ECG, sorry. And then you've got other things to deal with. And that's pretty much how you're going to do your admission. So once you've selected everything that you want in your admission, you are not limited here. So you can actually go in and add some orders. So like I said, I said that VRE screening is not part of the order sets, so it would be a nice thing to add. So you can go ahead and put that as a rectal swab, rectal. So you can go ahead and put that, and then also COVID is not one of the things. So what you do want it to be the rapid SARS, and then we can do that actually as urgent. And then go ahead and click nasal, and then go ahead and unspecify that. So those orders can be added. You can also add specific medications that you might want to put in here. So for CAD pumps, if you're putting in a CAD pump, you'll notice that the word CAD does not give you what you need. CAD pumps fall under palliative care PCA infusions. So you do have to put in the word palliative if you want a CAD pump. It doesn't populate with the word CAD for whatever reason. And then that order set will have the option to click subcutaneous here. And then you can go ahead and select your doses. I'm going to go ahead and start one on this patient. So morphine is obviously not going to be my choice. You do want to be aware that there's different concentrations. So there's a hydromorph 10 and a hydromorph 1 here as per mil. So I'm going to go ahead and select the 1 per mil as my order, and then I'm going to go ahead and fill out this part, and that can get handled by nurses. So that's one of the options you have in terms of orders as a clinician. You can add, you put it in as add-on. You can do your referrals to CCAC and physio and all those things, or you can do a consultation. So if you're going to do a consultation, I'm going to show you here. So general surgery, anesthesiology, and OBS are the only options that we actually have in-house. If you're going to do a consultation to a team as opposed to a provider. So for example, with general surgery, it may be Dr. Long, it may be Dr. Sterling, we're not sure which one. We can go ahead and select a provider group. The catch here is that you do want to put in the prefix QEL to determine, because this will actually give you the options for other hospitals as well. So putting in QEL will narrow it down to a team within our hospital, and you can go ahead and select general surgery. And what that'll do is it'll trigger the consultation to all the providers in that group, and then they can choose amongst themselves which one will select it, and that sort of happens naturally in the background. If one selects it, then the other one no longer has to select it. So this is an option for consultations as well. If you want, you should communicate to your provider and it gives you just a brief text here. And then so that's pretty much everything that I wanted to discuss with you guys to help you out a little bit with your admissions. I apologize that this is a lengthy little video, but I'm hoping that it will make things a little bit easier. So here's one of those override orders. I do want to proceed with my analgesia for that patient, so we're good with that. You'll notice here sometimes that things are in red here. If you've got something that's in red, it means you've got a next required field. So go ahead and put a reason for your chest x-rays. So just put routine there, and then we can go ahead and click on the next one as well. And then so we need a source for that. Next.